In Japan, it is estimated that there are about 11 million people with diabetes. Diabetes is a chronic disease associated with multiple complications, leading to higher medical costs. Japanese diabetes-related expenditure was $35 billion, accounting for up to 6% of total healthcare budget. Therefore, diabetes management is crucial both medically and economically. Here, we propose 5 system-level innovations for better diabetes management.
To implement our projects, we selected Sendai as a model city. Sendai is one of Japan's ordinance-designated cities with a population of 1 million. Its aging rate and percentage of the working-age population reflect the demographics of Japan. Previous cases have shown that Sendai could be a healthcare innovation-oriented city. Therefore, we are focusing on Sendai for the first trial of our projects over the next 3 years.
Our first project is treatment stations. The annual discontinuation rate of diabetes treatment in Japan is about 8%, particularly high among males with jobs or those with poor or fairly good glycemic control. A study suggests that this situation stems from constraints related to time and location. In diabetes management, the role of primary care physicians, especially in the maintenance phase, is crucial. Our project aims to ensure patients stick with their primary care physicians by addressing these constraints. Based on a meta-analysis of 42 randomized controlled trials, we will use telemedicine for long-term diabetes management, not only ensuring patients stay connected with their physicians, but also providing more effective diabetes care.
We are establishing telemed stations at 66 Tsuruha drugstores, the most popular chain in Sendai with dispensing pharmacies. Here, we will provide a simple blood test and telemedicine. Our service is eligible for diabetic patients already diagnosed and whose condition is stable, such as those receiving long-term prescriptions for the same medications.
Patients visit the treatment station at a pre-arranged date and time with their primary care physician. First, the pharmacist explains the testing procedure and obtains consent. Then the patient collects blood from their fingertip and the pharmacist analyzes it. Patients then move to a treatment room for a video call with their primary care physician to discuss symptoms and results, focusing on skin and the extremities. The stored data will be managed via the core server. If a prescription is needed, it's printed at the treatment station, and the patient takes it to a prescription counter. Patients receiving diabetes care see their primary care physician at least annually for detailed examination.
During the COVID-19 epidemic, registered telemedicine providers surged temporarily. However, the increase has since been gradual, with only 15.2% of medical institutions adopting telemedicine by April 2021. To establish telemed stations, we will initially encourage Sendai clinics to adopt video calling services. The locations of the telemed stations will be optimized based on this criteria.
Here are the pros and cons of our service. Even those without digital equipment or familiarity with video calls can receive remote medical care with support at the treatment station. Additionally, as more city clinics support online medical care, home-based online medical care is expected to increase for digitally literate individuals. However, some diabetic patients struggle to travel from home, requiring home nursing or medical care for management in such cases.
Our next innovation is the chatbot alarm system. One of the factors affecting drug adherence in the general population are forgetfulness and misdose response literacy. So our solution, a chatbot. We decided to use Line for its widespread usages in Japan, and to create a chatbot, you need a tool called API, which is a vague term used to describe the bridging of data between different platforms into one place, from the patient or the user to Line and web server and to the back-end call server, and vice versa. And here's the main function of our chatbot. Let's see how the user interface would look like. First, you have the menu bar, which directs you to the different functions. You could click on the drug schedule menu, for example, and it would redirect you to our scheduling form. You fill in the time and the drugs, and it sends you messages to take your medication at a designated time. Second, you click on drug usage, and it takes you to an external drug database. You can know exactly what side effect you should be aware of or what drug interaction you should avoid. When you miss your drug, say insulin, and you don't know what to do, it's been 2 hours, 4 hours, click on the missed dose menu and it will take you to the missed dose information. You could also type in your concerns. The bot trained using basic machine learning function will perceive different messages and deliver the proper responses. We also include the daily glucose recording system. You can voluntarily export the result, glucose level graph, missed dose information request, and so on. Print it out or show the QR code to your pharmacist so that they can work out the root cause of your medication problems. As you know, to treat chronic diseases like diabetes, every party must be involved to get the best possible result for the patient. But how about those without smartphone, elderly for instance? We have a few solutions for that. First, a modified version of a speaker is used solely for notifications. A caretaker or pharmacist put in the time you have to take the drugs and you're good to go. And we would also supply the blistering packages for anyone who needs to take multiple drugs. They can manually store the drug with supervision if needed from the pharmacist.
Our next project is a VR simulation of diabetes complications.
Some diabetic patients may know the complications of their disease, but how much do they really know about what happens after that? Our goal is to create an emotional impact on the patients, convince them to take care of their health, and to give them virtual experiences about the disease.
The VR booth will be set up in the NCT's department in public hospitals in Sendai. When the patients wear the VR glasses, they will see the 360-degree videos of diabetic complications. Our plan is to collaborate with Tohoku University, who had experience in making VR simulation video. The first complications video will be developed within 6 months. Then a pilot project will be launched at 5 selected public hospitals in Sendai. We will study the impact and collect the feedback and use them to improve the other videos, which will be continuously released one by one. We will expand the number of hospitals in this project to 15 and evaluate the project tri-monthly to improve strategies and increase engagement. Now we will shift our target to doctors and nurses with AI that will help them predict diabetic complications.
Let me introduce you to Bravo Diabetes Model. It is a personal-level model that uses AI to simulate the progression of diabetes complications based on individuals' characteristics. It is developed to calibrate from the US to the international patients globally.
It uses demographic, geographic, and behavioral factors to calculate the risk of each complication in a 5-year time. We plan to subscribe to the Bravo model and implement it in Sendai's clinical setting to study and compare its effectiveness in the Japanese population. If it shows favorable results, we will then develop our own AI for the sustainability. But if it doesn't, we will cancel the subscription, explore deeper about the barriers, and find the solutions to overcome them.
In order to enhance the quality and continuity of diabetic care, it is important to cultivate a holistic model of treatment for the health personnel. We will implement an e-learning system for physicians focusing on treating diabetes in primary care settings. The physicians enrolled are expected to understand and apply 6 pillars of chronic care model and become family doctors who can bring about the holistic framework into medical practices. Our pilot plan includes doctors who already treat diabetic patients in primary care settings, and we will incorporate the learning to be an optional part of the medical education curriculum later on as well.
Here are the detailed budget plans of each project. We use approximately $700,000 in total. The other $300,000 will be saved for changes regarding our 3-year plan.
Now let's have a quick recap of our 5 projects. Number 1, telemedicine. More accessible and easier for the patients to speak with the same primary doctor. Number 2, chatbot system. Your personal pharmacist in your own hand. 3, VR, immersive experiences of the disease. 4, AI. Nurses and doctors tools to predict complications for better preparation. And number 5, e-learning, preparing doctors for chronic care. Our critical success factor is utilization of existing technology and being adaptive to the local context.
Here's our overall plan in Year 1, Year 2, and Year 3. And these are the references. Thank you.
We are Team OverSea.